Okay, the type and severity of parietal sorry, I am butchering it, I'm so sorry. Parietal stroke symptoms are based largely on the occasion and the size of the injury, but can include impairments such as speech, thought, coordination, and movement. Like all strokes, a parietal lobe stroke involves either the rupture or blockage of a blood vessel in the brain. It is resulting lack of constant blood flow to the parietal lobe that deprives that area of adequate oxygen and causes cell death that impairs many sensory, visual, and/or language functions, sometimes permanently. The parietal lobe, one of four lobes of the cerebral cortex, whose role it is to process senses so that you can orient yourself in space, process language and math, coordinate movements, and different objects. So the common symptoms are how it impacts other parts of the brain will ultimately determine the type and extent of symptoms experienced. For most people, the left hemisphere of the parietal lobe is the language center of the brain, while the right hemisphere is responsible for cognition, calculation, and spatial orientation. Broadly speaking, the symptoms of a parietal lobe stroke are defined by which hemisphere is affected. With a right-sided parietal lobe stroke, there may be left side weakness, abnormal sensations on the left side of the body, usually paralysis or paresthesia, inability to see out of the lower left quadrant of each eye, spatial disorientation, including problems with depth perception and navigating front and back or up and down, inability to recognize objects to the left side of his space. So my friend Dave, I believe, had this kind of stroke. He doesn't know for sure what kind of stroke he, or remember, but I'm pretty sure this is the one. So it also includes inability to recognize the left side of one's own body, referred to by some as alien hand syndrome, loss of proprioception, the ability to know where your body is oriented in your surroundings, lack of awareness or concern about the left-sided impairment, impulsive, manic, or inappropriate behavior. With a left-sided parietal lobe stroke, there may be right-sided weaknesses also. Paresthesia on the right side of your body, inability to see out of the lower right quadrant of each eye, difficulty with speech or language comprehension, aphasia, problems with simple mathematics, impaired ability to read, write, and learn new information, lack of awareness that a stroke had even occurred, cautious or hesitant behaviors. But both right side and left sided parietal lobe strokes may also result in depression, memory problems, chronic fatigue. Okay, this word is hard, so bear with me. Asterogenosis, a sensory disorder in which you are unable to identify an object by touch. It typically occurs if the back end of the parietal lobe is damaged. Rare symptoms include it's not uncommon for a stroke injury in a parietal lobe to extend to parts of the brain, such as the frontal lobe, temporal lobe, situated both beneath the parietal lobe, or occipital lobe, situated toward the back of the cerebral cortex. It may also involve the brainstem and cerebellum. In such cases, the symptoms of the parietal stroke may be accompanied by classic stroke symptoms such as facial drooping or arm or leg paralysis. However, if the stroke injury is isolated in the parietal lobe, facial drooping and paralysis are far less common. While there may be arm or leg weakness, people with a parietal stroke don't usually experience a total loss of limb function. Gerstmann syndrome. There are uncommon conditions in which sensory disorders develop in clusters. One such example is Gerstmann syndrome, a rare disorder characterized by the impairment of 4 specific neurological functions: inability to write, or it's called apraxia, I think, loss of the ability to do math, acalculia, believe it or not, inability to identify fingers, finger agnosia, inability to differentiate between the right and left side of the body. Gerstmann syndrome is caused by damage or impaired blood flow to the upper sides of the parietal lobe, but may also be the result of multiple sclerosis or brain tumor. Apraxia. In some cases, a parietal lobe stroke can interfere with executive function. It's the ability to think abstractly and make decisions based on analysis and learned behaviors. Although executive function is believed to be carried out by prefrontal areas of the frontal lobe, it is the parietal lobe that feeds sensory information to that part of the brain. When the transmission of these signals is blocked by a stroke injury, it can interfere with how the brain plans movement. So your brain already thinks what it's going to do. So my brain already knew it was going to go like this. Does that help? It results in a condition known as motor apraxia, the inability to perform movements on command. Other variations include ideomotor apraxia. It's the ability to mimic a performed gesture. Constructional apraxia is the inability to copy a drawing. And eye-opening apraxia, inability to open one's eyes on command. Complications. The impact of the parietal lobe stroke can often significantly in the elderly who may already be struggling with cognitive, sensory, and movement problems. One common complication seen in older individuals with the parietal lobe stroke is delirium. It's an abrupt change in the brain that causes confusion and confused thinking and reduced awareness of one's surroundings. When a parietal lobe stroke occurs in the right hemisphere, the loss of recognition on the left side of the world can be extremely confusing and contribute to the loss of organized thought. Without the means to compensate for these sensory impairments, a person may become increasingly confused, inattentive, and disjointed in their thinking. Cardiac complications are common after a stroke with this. The complications of a parietal stroke can vary based on the types of severity of symptoms involved. However, unlike a frontal lobe stroke, where limb paralysis is common, the loss of sensory function in a parietal lobe stroke usually allows for speedier recovery of motor skills under the care of a physical therapist and occupational therapist. Speech and language impairment can be more difficult to overcome and typically requires ongoing and intensive speech therapy, which obviously I need. Studies suggest that at least 90 hours of speech therapy may be needed to overcome aphasia, and that anything less than 44 hours will likely be non-beneficial. How they came up with this fact, I don't know. Arguably, the greatest challenge is overcoming issues like hemispatial neglect or anosognosia. Hope I'm saying that right. In which the stroke survivor is not even aware of their impairment. In such instances, people are less likely to participate in rehab or may unknowingly place themselves in harm's way. Unless there is a coordinated intervention by a partner, loved one, or legal guardian, recovery can be difficult. Recognize the symptoms of a stroke. Recognizing the symptoms of a stroke can save your life or that of someone else. The American Stroke Association offers an easy-to-remember mnemonic, FAST, to help you know when it's time to call for help. FAST stands for facial drooping, arm weakness, particularly if it occurs on one side, speech difficulties, and time to call emergency services. If the first three were to occur, then you know it's time to do the fourth and call 911. If you're in doubt, take no chances, none, and call an ambulance. The signs of parietal lobe stroke can sometimes be less overt. It's important, therefore, to look for other telltale signs, such as visual blurring, loss of peripheral vision, or a sudden loss of balance or coordination. So, it's important to know the FAST thing. In my situation, unfortunately, I had the flu the night before it happened, and I was throwing up. And with me vomiting so hard, it dislodged. I had a clot in my clavicle area. It dislodged the clot and sent it up to my brain. So I told my son, I'm fine. I have the flu. Go to bed. It's okay. So he went to bed. I continued to throw up, I guess. And he found me the next morning in between my bathroom and my bedroom. And didn't know how long I'd been lying there. So he called 911. The ambulance came, and they also did not know how long I'd been lying there. So I didn't have the TPA. It's a blood clot thinner that dissolves it right away to save you from any more symptoms, I guess. And they didn't know how long I'd been there, so I wasn't administered that. But if you do, and you are aware of the symptoms, please call 911. Do not take a chance with your life. It is important. It's important for your caregivers to know that, for your loved ones, for everyone involved, coworkers, whoever. And with that, celebrate every victory, big or small, please. My friend Dave, that had this stroke, is back at work, has 2 jobs actually. He had loss of vision and he can see peripherally now. Not as great, but better than what he had at the beginning of the stroke. He's able to drive, hunt, drive a trailer, for crying out loud, and pretty much has gone back to the way his life used to be. With some, precautionary things that he does, but for the most part, recovery is possible. I've seen it, I've experienced it, and hopefully this gives you hope that you can recover too. I'll see you in our next video, which will be the 5th one, and there are way too many of them, and see you soon.